Hello and welcome to the maiden edition of HealthMed Info, only on Malachi TV. It's not new to say health is wealth. The problem we have is to know how to remain healthy as we advance in age. Some are exposed to know how to remain healthy and some struggle with their health. For us to continue to maintain our wealth and healthy living, we need to know when to visit the hospital, what to check or look out for. We also need to know what and who works in the hospital, their responsibilities and your responsibilities. These and many more are what we shall be discussing on HealthMed Info. I am Esther Michael. I will be right back after this short break. Stay with us.
It's not new again to say health is wealth. We all know that's true, but do you know when to check your health status? Do you care to learn about living healthy and bright? What to turn to when you're feeling not quite right? Join HealthMed Info for answers and insights to keep you in prime time on YouTube channel, Malachi TV, Facebook pages, MLC TV, MLC TV2, Instagram, MLC TV 2021, X under Malachi TV, and TikTok, Malachite_TV. Don't miss this valuable info on your way to help you live your best life every single day.
In today's edition, I will be joined by the chairman of the KOGI State Chapter of the Association of Medical Laboratory Scientists of Nigeria, the KOGI State Chairman of AMLSN, Vice Chairman of TUC, Comrade Obajemu Samuel, Dr. Siriagu, CEO Director AG Medics Diagnostics Laboratory, and Chairman Elder Forum Stakeholder, Comrade Amos Lawal. They will inform us of their roles and why they play the roles in the hospital. Together, we shall explore the roles laboratory play in our health sector. I welcome you, sirs, to HealthMed Info. You are welcome, sir. To my left-hand side is Dr. Siriagu. Please, sir, can you introduce yourself?
Thank you very much. I am Dr. Cyril Agu, the Medical Director and Chief Executive of HealthMed's Medical Labs, Lokoja. Thank you.
You are welcome, sir. Sir, this is Comrade Amos Lawal. Please, sir.
Thank you. Good day, our viewers. I am Comrade Amos Lawal, the former chairman of Association of Medical Scientists of Nigeria, and I work with Federal Teaching Hospital. I'm also the owner of Liberty Medical Diagnostic Laboratory behind Moremi Restaurants. Thank you.
You're welcome, sir. Sir, this is Comrade Obajemu Samuel. Sir, introduce yourself to our audience.
Thank you. I'm Obajemu Babatunde Samuel. I am the Chairman, Association of Medical Laboratory Scientists of Nigeria, and also the Chairman, Assistant Chairman, or Vice Chairman, Trade Union Congress, KOGI State. Thank you.
You're all welcome, sir.
Thank you.
As you have been told, they will be talking or discussing about Scientists Laboratory. Now I'll start with Comrade Samuel Obajemu. Sir, who is the scientist?
Medical Laboratory Scientist.
Yes, sir.
Well, I will forgive you because you might not be totally too informed about us, but then we are medical laboratory scientists, and we also have laboratory scientists that we call SLT. They are also scientists too, but they are not medical. But we here are medical laboratory scientists. We are a group of health professionals that deal with diagnosis using body fluids to diagnose diseases, and to ensure that the medical doctors have directions in the treatment of diseases in their patients. So basically, we are trained, we are certified, we are licensed to do the work, and then we work in the hospital, we work in the private sectors, we work in research firms, and so on. Thank you.
All right, sir. Thank you, sir. So what is the difference between medical laboratory scientists and laboratory scientists?
Okay, like I said, we have SLT.
Yes.
SLT is different from MLS. So SLT are basically those that went to the Polytechnic and get trained either in like microbiology or biochemistry, and they deal with animals for their practicals, while we deal with humans. You can afford to lose animals while training or while practicing, but we cannot afford to lose human beings. So as MLS, we are trained in anatomy, we are trained in physiology, we are trained in body biochemistry, all around, unlike the SLT that are just basically trained for animals. Thank you.
All right, thank you, sir. So what are the educational background and certification are required to become a medical laboratory scientist?
Yes, I think my stakeholder here should come in here.
All right, thank you for your question. Let me just throw more light on the difference between the medical laboratory scientist and the science laboratory scientist. Like here, I'll just try to explain. Now, the medical laboratory scientists, just like he said, are trained to work basically in hospitals and other settings. They are trained to analyze human samples. And that is why you find that the medical laboratory scientist is listed among the human resource persons. That's human resource for health, and domiciled under the Federal Ministry of Health. While the science lab tech, who are structured to work in science laboratories of secondary schools, tertiary educations, they are domiciled under the Federal Ministry of Science Technology. They are not under Federal Ministry of Health. That is the basic difference. Coming back to your question, please, what's your question again? As regards, okay, what are the qualifications?
Yes.
Now, to become a medical laboratory scientist, you have to undergo a course of training. First, you must have your 5 credits pass from secondary school sciences. That include your biology, chemistry, physics, mathematics, and English. And then you apply to an accredited school, accredited university that is under the Medical Laboratory Scientists of Nigeria. That school must have been certified or accredited and given approval to train you. You undergo a 5-year training, what you call BMLS training, Bachelor of Medical Laboratory Sciences training for 5 years, following which you go through the 1-year internship period where you are posted to hospitals to go and have the necessary experience to be able to work. After which you now go for the mandatory national service. After this, you can now be licensed. Initially, you are licensed as a provisional medical laboratory scientist. But after you have finished service, you can now go and be licensed as a practicing medical laboratory scientist. That will now enable you to practice. But then, formally, this was not the case before. It was of recent, around the late 90s, that we now have what we call the BMLS. Ab initio, the medical laboratory sciences started off as medical laboratory technology. It dates back to as far back as 1945. There was this scientist known as, he was a technologist then. His name was R.A.O. Shonekon. Incidentally, the brother of our former interim president, N.S. Shonekon. He was the first to qualify as a medical laboratory technologist in 1950. He was sent to to London,
UK.
London, Institute of Medical Laboratory Technology in UK. So they were involved in training our people. So when he came back, he decided to set up what we call LTTS, Laboratory Technician Training Scheme, in VOM, as far back as 1950. So he was the first qualified medical laboratory technologist. Other people also were sent for this training. When they came back, they also tried to establish 1 or 2 schools. There was the Federal Medical Laboratory Sciences that was set up in Lagos, eventually moved to Jos by PA Imodun. But with time and as a result of the pressure they created, they were able to have some of the schools accredited and also registered in Nigeria here to start the training. And eventually in 1968, the government of the then General Yakubu Gowon was able to promulgate Decree 56 of 1968, which gave the first regulatory body known as the Institute of Medical Laboratory Technology of Nigeria in 1968. Then following this, around 1999, as a result of changes to the law, it now became Institute of Medical Laboratory Technology, Science and Technology. And it was now Decree 54, no longer Decree 56. And eventually, we have an Act of the National Assembly, which gave the power for the formation of the Bachelor of Medical Laboratory Sciences that we now have today. So today we have Act 11 of 2003 that now regulates the profession. So that is the process through which you can become a laboratory scientist today.
All right, thank you very much, sir. To Dr. Siri, you have a laboratory, sir.
I do.
What is the primary responsibility of a medical laboratory scientist in the health sector?
Thank you very much. Maybe we'll be speaking from the perspective of medical laboratory sciences. But I want to say that medical lab sciences are much bigger than just the health, because we have the skills that are transferable, and that makes it possible for us to work in organizations and institutes that are not, strictly speaking, medically background. So like talking from the angle of medical lab sciences, I am a medical lab scientist. In my place, we have various levels of investigations we do. The ones we use blood, the ones we use stool, that is X-ray time, the ones we use urine. And then we use even pus, things that ordinarily are rejected. Those are the things we investigate, and we use it to make inferences on the system where they were derived from. Like if you have something like boil, and we take an aspirate from that boil, we want to establish what exactly is causing that boil in the first place. And we do something we call the full blood count. That one, even if you did not see the patient physically, and the sample of the blood is brought to the facility, by the time you're going through the investigation, examining the blood, doing what we call the blood film, it will look as if they're hanging the person just right there and do an X-ray who the person is and what the medical conditions are. Then looking at the urine, somebody is having an infection and you take urine. Urine will speak volumes about what is happening within the urinary tract. Then the discharge, is it from the urethra, is it from the vagina, whichever it is it from the ear? For instance, somebody that is having otitis media and the ear is discharging. We don't need any other material to work with, other than that one that is rejected, the pus that is coming out. When we subject it to very strict investigation, we'll be able to come up with what is causing that otitis media. So the level of investigation is quite diverse. We use skin, tissues to equally carry out investigation, even the hairs. It all depends on where the ailment is coming from, and that determines what you're going to do to be able to unravel what exactly is responsible. Thank you.
Thank you very much, sir. I think my next question, you have answered part of it. Maybe sure you can still throw more light on it. So what are the specific laboratory tests and procedure do medical laboratory scientists perform? Yes, sir.
Like you said, you have mentioned the various samples.
Yes.
You know, medical laboratory sciences cut across different disciplines.
Yes.
We have what we call hematology, chemical pathology, microbiology, parasitology, virology, mycology,
immunology,
then immunology, histology. So the various tests you do most times is determined by the discipline. You understand? And then the presentation of the patient. Yes, the doctor determines what patient or what test you are going to do. Maybe the doctor haven't examined the patient clinically. We'll look at the patient and say, okay, look, go to the lab, let them test you for this. When you get to the lab, we now direct you on which of the disciplines to do your test. And like you just mentioned, we take various samples, and depending on the discipline, these samples are sent to, and what the doctor requests for. So many tests can be done. Is it test for diabetes? Is it test for infection? Is it test for cancer? You understand? Is it test for infection? So it all depends. The tests are so many that if we want to sit down here and take each one, it will take us hours to do. But in broad term, our function is to diagnose the cause of an ailment using various body fluids and excretion tissues.
And quickly, I just want to add to that MLS have gone molecular. We are going into beyond the rudiments, and we have gone into molecular testing, diagnosis, whereby we use equipment like PCR or PCR methods to diagnose diseases, what ordinarily some other sophisticated machine might not be able to find. So we are going higher and higher, and we are hoping that KOGI State we actually invest into this kind of molecular diagnosis, like when we had like Lassa, like coronavirus, and so on. Like now, if we collect samples here in Lokoja, we might need to send it to Irua because we don't have a molecular facility here. So I think this is where the government should start looking at, so that when we have all this molecular equipment, we'll be able to even diagnose more diseases. Thank you.
All right, thank you very much, sir. We'll go for a short break. We'll be right back.
Healthy living. It's time to thrive. Get the facts, take control, and stay alive. HealthMed Info on Malachi TV Online, your go-to guide for a healthier life. Expert advice, tips, and more in store. Tune in every Saturday at 5 p.m. with Esther and open the door to happier, healthier you every day with HealthMed Info. Stay alive.
Welcome back. We are still on HealthMed Info, and we are still on discussion of medical laboratory scientists. Still with you, Comrade Samuel. Sir, what is the relationship between the association and the government concerning the advanced equipment to be used?
Okay, actually I just came on board barely 1 month ago, but coming on board, we will engage the government and ensure that the state government look into this aspect of diagnosis. We have gone beyond RDTs, meaning using strip tests to diagnose malaria. We should be using molecular to diagnose malaria. And so we'll be synergizing, consulting, and advocating with the state government to see how they can bring in these machines into the state. I know Federal Teaching Hospital has this setup, but up till now it has not been in use. We also hope that they can also activate the use of it so that it can help the people of KOGI State. I'm also aware, and I want to commend the outgone governor, His Excellency Alhaji Adoza Bello, for the great work he did in reference hospital in Okene. We hope that the molecular diagnosis will also be put in place by this present governor, His Excellency Usman Ododo. And so we will keep relating and fraternizing with the government to ensure that this particular high-tech diagnosis come to Kogi State. Thank you.
All right, thank you, sir. We have not heard the Medical Scientific Laboratory Association for a long time now. Sir, where have you people been?
Well, actually, this will make me say so many things that has been happening in the state. To start with, in Kogi State, we have about 60 health institutions. This is aside the primary health care outfits. And we have just about 25 scientists to cover 60 health institutions. This is not encouraging. Whereas we are supposed to even have at least 4 in each facility to cover the 4 basic, that is hematology, chemical pathology, microbiology, and histopathology. But we just have even less than 1 because out of 60 institutions, I'm talking about HMB particularly, Hospital Management Board. We have about 60 hospitals, and then we have just about 25 scientists. So to now ask these people to travel down, these scientists that are not even motivated, their salary structure is not comparable to counterparts, the medical doctors, and we don't expect that they should be happy. The government has actually concentrated more on the medical doctors and putting aside the medical laboratory sciences. But we are hoping that as we come on board, we are going to engage the government. We have been in the cocoon, but we are coming out of it, and we are coming to limelight by God's special grace and make sure that medical laboratory sciences is known everywhere. And we will synergize with them even in the aspect of quackery, because only some people are involved in the issue of quackery. But we are going to synergize with the Ministry of Health to ensure that quackery is put an end to in this state. Because you see mushroom laboratories here and there, like our dear CEO of Admedis. If you go there, you will know you have a standard laboratory. We have another one, Beacon Laboratory. When you go there, you will see, and our boss here, to Liberty Laboratory, you will see some level of standard and compliance with international best practice. But because, but if you now go to some of these hospitals that we are talking about, that even government hospitals, the best international practices are not there. So we are going to synergize, we are going to advocate with the state government to ensure that that is done. So coming on board now is to come alive, is to come to stay, and make sure that the government knows and do the needful in the state. Thank you.
Thank you very much, sir.